Dear friends, hi. Welcome back to Alpha Physio Pelvic Care. All things pelvic health and beyond. Today, a very special episode. I decided to create this episode for people who had hip replacement and are wanting and willing to do pelvic floor exercises and take care of their pelvic floor. And now, right now, I'm sitting in the position that is not optimal for people who had hip replacement. And this is often the case if you see pelvic floor exercises in internet, or maybe you see it in the place where you go. There is a lot of movements that are either not recommended or dangerous for people who had hip replacement. On the other hand, when somebody had hip replacement, research shows that pelvic floor on that particular side of hip replacement, whether it's one hip or two hips, can become weaker. So it's very important to continue to take care of your pelvic floor, even if you had hip replacement, as well as other muscles around, in order to preserve your function and your ability to move the way you like. So today I will give you several examples of the exercises. You can pick and choose. It's not going to be throughout working out program. I'm just going to give you examples, explain to you why we're doing them, how safe they are for people for the hip replacement, and then you can choose 3 or 4 exercises to do every day for about 10-15 minutes. Now let's first quickly recap what movements we would like to avoid when somebody had hip replacement. Before that, if this video is relevant to you, if you enjoyed, don't forget to press like and subscribe to my channel to be up to date and receive video every week. So first of all, we want to avoid a lot of hip flexion, to be exact 90-degree hip flexion and more, especially with overpressure, okay? That can be quite dangerous, especially in the beginning and early stages of rehab after the operation. We also want to avoid a lot of internal rotation. And this, for example, exercise is very popular on the internet, but probably not recommended to somebody who had a hip replacement. Also, we want to avoid a lot of adduction, so lifting up or sleeping with your legs crossed, especially in the beginning stages of a rehab. So what's left there? Let's have a look. The first exercise is bridge. Bridge is very popular exercise, and it works your glutes, your pelvic floor, your deep abdominals, and we can create variations for these exercises that are safe and hip replacement friendly. First of all, we lay down onto our back, nice and relaxed. Take a deep breath into your sides, so lateral rib breathing. If you're not sure what it is, you can check out my other videos on breathing. So we breathe in, and as we breathe out, we scoop our pelvis in and start lifting vertebra by vertebra, feeling glutes engaged, feeling tummy engaged. Breathing in and relax. This is nice, safe movement. Working our glutes, working our pelvic floor. Breathing in and breathing out. Here, you can add a variation of lifting your heels. So you breathe in, breathe out, push through your heels. This will give you a little bit more hamstring engagement, a bit more gluteal engagement, and probably will help you to feel that pelvic floor muscle, that area around your perineum between your vagina and anus, or your penis and anus if you are a male. Breathe in and breathe out. Here we can add a little bit adduction, so slight opening of the hips to kick in the side gluteal muscles. Breathing in, breathing out. I can feel those glutes, gluteus minimus, medius, the fibers, the side fibers of glute max. Breathe in and breathe out. Here my big toe stays on the floor. I'm not rotating out on my heel. My big toe is still in the contact on the floor. Breathe in and breathe out. And one more variation where we still can exercise our inner thigh muscles without putting extra adduction, so crossover movement. We can place a small ball and squeeze it, therefore keeping our neutral position on our hips. Adductors are kicking in together with our pelvic floor and our glutes. Perfect. Breathe in and breathe out. Breathe in and breathe out. You can repeat each of these exercises about 15-20 times. You can pick and choose which one you like. You can do them all together. It's really up to you. They're all great on activating your pelvic floor together with your legs and with your pelvis, because your gluteals, your abdominals, your deep glutes and pelvic floor, they really work together. Let's move on and let's change position a little bit. So here I'm going on a 4-point kneeling, and here I'm in my safe zone of 90-degree flexion. I'm distributing the weight between my hands and legs, so not too much pressure throughout the hips. I'm holding here with my hands. And here we're going to do leg extension, focusing on keeping our neutral and engaging our glutes. So taking nice deep breath in, into our sides, breathe out. Imaginary slow motion kick into the ceiling was trying to keep our back neutral. So we don't want to go into the arch, right? Neutral. Feeling that tension in your glutes and in the back of your leg. Breathe in, returning to our safe 90 degrees supported. Breathe out. You can add a bit of side opening. External rotation is fine. Breathe in and breathe out. Breathe in and breathe out. You can do this exercise about 15-20 reps on each side. Don't forget to do each side as well. Even if you did not have a hip replacement on the other side, it's good to keep that balance. Also, let me note that these exercises are not your hip replacement rehabilitation exercises. You will do your rehab process separately, and after the doctor has cleared you, which is usually about 6 to 8 weeks, you can go back to your normal activities with precaution. You can start to do your pelvic floor exercises that are hip replacement friendly. From here, we can also go into some extension, and I will bring my hands a little bit forward. Breathe in, breathe out, engage my abs. Take weight over onto my hands, controlling my back. I'm not going here into drop down, okay? One more, breathe in. I'm carrying my weight over, engaging my abdominals, engaging my pelvic floor. I feel the control. I feel that I control hip extensions. I'm not dropping down. Breathe in, return. Here is important to mention, we don't want to do this, okay? We return to our 90 degrees, supported. Breathe out. Control the extension. Breathe in. Breathe out. Nice. Here you can go onto your high kneeling. I'm grabbing ball here as an accessory, but you don't have to use it. You can just hold your hands together. And here we're doing our drop backs. Very important part here is we imagine that there is a metal rod going through our back, and we are not arching, neither we are sitting down, okay? We just do a small drop back from our knees, feeling tension in our quads, engaging our tummy, keeping back neutral. Let's go. Breathe in, side breathing. Breathe out, gentle squeeze of the ball. Feel that engagement. Make that breath a little bit longer. Breathe in, breathe out. Feeling your glutes squeezing, feeling that tension here. Drop back. Again, we don't want to go too far. We want control. We want to feel that nice tension in a controlled manner. breathe in, and breathe out. You can do this exercise for about 15-20 repetitions, and remember, the quality, not the quantity, is important. And of course, we want to work those deep gluteals, our glute minimus as well. So we can lay down onto our side. Here, I will not lift my bottom leg like I quite often do with my other clients. Here, we want our hips nice and neutral, even less than 90 degrees. We have here a ball as an accessory. You can just use your hand as well. I'm supporting my head here. You can also lay down. It's up to you. The most important bit here, lift gently your waist so you have a small gap. Make sure your back is neutral. You're not arched too much. And here, we take a nice deep breath in into our sides. Breathe out. That pressure of the ball will give you an extra kick of engagement of your deep abs. It's great. Use it. Breathe in. And breathe out. I'm feeling my tummy engaged. I'm lifting my knee. Feeling here in this area. Breathing in and breathing out. It's external rotation, so we can do this move. Or you can do the whole leg lift. It's abduction. So moving out, breathe out, breathe in, breathe out, breathe in. You can use this movement alternative manner, or you can do one and then another. You can repeat about 15-20 repetitions of each move. Remember, do the other side as well, even if it's not operated. And for your stretch, come onto your front. I'm here in a cobra position, placing my head on my hands, breathing in, breathing out, extending. And here I'm not just pushing myself up from my hand, I'm actually drawing my abdominals in, feeling them moving away from the surface I'm laying on. So one more time, breathing in, breathe out. Engaging. Make that breath a little bit longer, so give yourself a little bit more time to engage. Don't rush. 3-4 second breath in, 3-4 second breath out. Breathe in and breathe out. Nice. So these exercises are great, are safe. If you had hip replacement and you finished your rehabilitation process and you want just to upkeep that gluteal strength, that pelvic health without compromising safety of your replaced hip area. I hope you enjoyed this video, guys. Let me know if you have any questions in the comments. Don't forget to press that like and subscribe button, and we will see you very, very soon. Bye.